Good afternoon and welcome to United TV. Today is our Bariatric Friday day, so Dr. Irgau is joining me. We are going to cover our topic 2 in the cycle, and we are going to cover what to expect after bariatric surgery. Now, yes, we have covered this so many different times, but the issue is every time we cover these, we may be repeating some of the same issues, but from a different perspective, but also we may have some new points. So we are going to have Dr. Irgau to help us with this process today. And Dr. Irgau, how are you doing?
I'm doing great, Kemal. It's wonderful to be back for another Bariatric Friday session. I have to tell you that your previous session with the chairman of CEO of Oracle Health was fantastic, was excellent. I myself learned a lot. I did not realize that, as organizations, they pay attention to things like provider burnout, which is a real issue. And they want to provide solutions, right, from a tech point of view, which would be extremely good. So thank you for that. That was very well done.
And the feedback is always important. And, in that session, one of the things was what's important. Are we able to do certain things easier or easily? So, and one of the examples that I was giving, like being ready for these events.
Yeah. Yes,
absolutely. What types of tools I have, what types of access I have. Do I pay X, Y, Z? And can I do it? Can I not do it? And can I do something that's going to take 10 hours in the old way? And then can I do that in 1 hour? Yeah. So 10 hours, if that was taking that much for this YouTube session, Dr. Irgau, we probably wouldn't be here. Because
no question.
Our main business, our full-time job is not this. Yep. But if I'm able to do this for 1 to 2 hours a week and still able to do what we are doing, yeah, so then that is kind of the key for this whole thing. And I'm hoping that with the EHR, with the Oracle Health, it's going to actually provide us what we are looking for. There are a lot of things that providers, yourself, other providers who are going spending way too much time for something that can take 2 minutes.
Yes, absolutely.
So,
absolutely.
And I think seeing that approach and also seeing the actual work, that makes a huge difference. And speaking of tools, this is why we are doing this. So bariatric surgery is one of the most effective tools, and similar analogy that we can use with what's like ChatGPT can do versus just a simple Google search. Mm-hmm. I need information in a meaningful way. Yep. Fast is available. So this is why we are discussing the bariatric surgery as being the #1 option for those who are fighting morbid obesity, and that's why we are here today. So from the the overall outcome, if we can kind of summarize what patients are expecting, what we are expecting to see after the bariatric surgery. Now, keep in mind that we cover each topics in a different session, its own session. So just overall, if we can kind of give us that brief summary.
Absolutely. So essentially, after bariatric surgery, the most visible change we see is people's life changes in a beneficial way, completely. Their sense of well-being, their ability to independently move around and do tasks that were difficult before, their self-esteem, their overall health improves. Mm-hmm. This is what we see in bariatric patients. And I have to tell you, one of the reasons bariatric surgery is so appealing to surgeons like myself who practice it on a daily basis is that satisfaction of meeting the patients after the surgery, right? They've recovered well from their surgery. They're losing weight, particularly in the early weeks and months after bariatric surgery. They have the fastest rate of weight loss. So within weeks, they find themselves shedding 40, 50, 60 pounds, right? And with that, there is a sense of liberation because the change is so fast and so quick. Obviously, they notice it. They notice it immediately. Like their weight, the high weight was just a few weeks before, and now they have a different weight, which changes the way they look, the way they feel, the amount of energy they have. And then beside that, there is the improvement, objective improvement in many health conditions, right? They find themselves now taking less and less medications for problems that they struggled with, when before obesity was addressed with bariatric surgery.
So now, if we can talk about the increased energy levels.
Yeah, absolutely.
So are we expecting this from every patient? Is it changing from one to the other? What do we mean by increased energy levels?
Well, when you speak with a patient who's struggling with severe obesity, and I'm talking about a patient who has an extra 100, 150, 200 pounds of weight over their normal weight, right? So a patient who's, for instance, 5'5" and their normal weight would be around 150, 160 pounds, and yet they are at 280. They may be at 300, sometimes 320. When they are waking up every day with that weight, they don't have energy. It's no surprise for a number of reasons. First of all, physically carrying that extra 100 pounds, extra 120 pounds, and trying to do things that people take for granted, small things, is very, very hard. It may be as simple as leaning down to pick up something that fell on the ground, as simple as putting your socks back in. That takes tremendous energy. There's a lot of shortness of breath with that. Not to mention the fact that their sleep is very often not restful, right, because of sleep apnea. So with all that added, even before the day has begun, they don't have energy, and they will tell you that. It's really a miserable life. And then suddenly you are liberated from that much weight, right? You have an ability to move around. You're sleeping better. Of course, you have tons more energy, and you feel it. Of course, immediately after surgery, in the first couple of weeks or so, there is going to be the surgery effect, anesthesia effect. So they may not feel as much energy immediately, just because there is recovery from surgery. But then 3-4 weeks afterwards, they're fully recovered from the surgery, and they can see the amount of energy they have. So this is actually an energy that drives their daily activity. They feel it. They know it, that a lot has changed, and they want to do more.
Thank you for that, Dr. Irgau. So just wanted to check something with the technical side, because I see your side is on mute, so I'm just double checking whether or not they can hear you okay. I'm assuming that they can, because we did the sound check. So I want to talk about one of our patients from this morning. The patient was 517 pounds. When our nurses presented this patient, the way that they actually brought the patient up as our patient has mobility issues. So I asked our nurse, I said, "What's your weight?" Well, she gave me the numbers. So whatever 517 divided by 4 is the number. So I said, well, she is 4 times your size.
Mm-hmm. Mm-hmm.
How do you not expect him to have mobility issues, right?
Absolutely.
So that's kind of like one of the main challenges we always have with people. Like, oh, are you just cutting people's stomach? No, we are helping someone who's at 500, 400, 375, 350, whatever their height situation also is.
Yep.
So this is bringing the mobility issues. This is bringing the energy issues. When as you are carrying more and more and more, your body actually is doing more work. So
Totally.
Just like if I'm holding this glass for 5 minutes just in this position, this is going to get 5 times heavier at least, and I won't be able to do it anymore, right? So, and from that point, that's important for a patient to know how this is going to actually help them for the future with their overall health. Now, if you were to look into this from self-esteem standpoint, we want to focus on the great results of bariatric surgery and self-esteem, mental health issues. They're kind of like going hands in hand, and the morbid obesity is in the center of these issues in many cases. Can you give us some expectations for those patients, what they would be expecting?
Absolutely, absolutely. There are a number of reasons why patients who struggle with obesity also have depression very often, right? And the reason for that is because the obesity itself is obviously physically limiting them, right? Limiting what they could do, the things that I want to enjoy, whether it's by themselves, with their families, right? Simple things like you're a parent, right? And your kids want to go on a ride, right? On one of these rides, maybe they want to go to Disney, right? You take them there, you want to do rides, but you cannot fit in. You cannot be with them, right? That is a limitation that really mortifies people, right? And then on top of that, you've got the stigma of obesity, right? Because our society, instead of extending a hand and saying to people, how can I help you, is a judging society, particularly when it comes to obesity, right? So people feel that on a daily basis. Once they lose the weight, of course, they are liberated from that. That's why their self-esteem, their feeling of happiness is a lot higher after they've lost weight. And that happens very, very quickly after bariatric surgery. As I said, the vast majority of the weight loss occurs actually very shortly after bariatric surgery. So within the first few months, people will have lost maybe 60, 70% of the weight they're going to lose totally, through the process. So that is what I'm talking about when I say people feel really much better. They feel so much better about themselves, and they project well, and they don't feel as guilty or as judged when they are walking around or interacting with others once they don't have the weight issue.
That's, even at a different level, losing a little bit weight, if you feel like you need to, and then being able to see that, it gives you a lot of confidence.
Absolutely, absolutely.
So we have discussed the longer life expectancy, and this is not just some subjective way of looking at it, but there are studies that shows us obesity is linked to life-threatening conditions. And with this very powerful tool that we are talking about, the bariatric surgery can help to move that barrier and help those patients to have a longer life expectancy. So when we discuss life expectancy, just elaborate that, what we expect with these individuals.
So essentially, what happens, Kemal, is that the complications of obesity include also illnesses that are really the top causes of mortality in our society, in our country. And I'm talking about cardiovascular disease, which includes things like heart disease and strokes. I'm talking about high blood pressure. I'm talking about metabolic illnesses like diabetes. I'm talking about conditions like sleep apnea. All those contribute to the mortality, to the highest causes of mortality in our country, in our society, right? And they happen to be very closely related to obesity. And once you address obesity with bariatric surgery, you're actually reducing the presence of these conditions in that person. High blood pressure is reduced by 70%. Cardiovascular disease is reduced by about 80%. Things like type 2 diabetes reduced by 60, 70, 80%. Sleep apnea reduction can reach 95%, right? With that reduction, you're also taking away the risk of dying. In fact, people have looked into it and they've calculated that the 5-year risk of dying after bariatric surgery is reduced by almost 90% if you've had bariatric surgery. In other words, if you take a person who's had bariatric surgery and then another person with similar excessive weight, extreme obesity who has not had bariatric surgery. And if you follow them for 5 years, the person who's had bariatric surgery has reduced their risk for mortality by 90%. It's tremendous. You are essentially adding years to that person's life simply by doing bariatric surgery. Now, if you ask me, is there any other medical intervention, single medical intervention, that can result in that amount of reduction of mortality, in that extension of the life expectancy? I would tell you there is none. Bariatric surgery is unique in that sense because it is taking care of a core problem that is causing many of the reasons of why people die in our country: cardiovascular disease, high blood pressure, type 2 diabetes. And you're addressing all this permanently. You're not just giving medications to control these conditions, right? You're addressing them permanently because the driving factor of all these diseases is very often obesity. So absolutely, reduction of mortality, extension of life expectancy are some of the extremely important benefits of bariatric surgery.
Now, today we are in our new cycle with Bariatric Friday. We are going to discuss why patients drop out of the program. So this is a really important topic for us because for a program which has like a daily case conference discipline, we see this very closely every time this happens. So today we want to kind of help those to understand what are the issues and how to overcome those problems. And if we can kind of start with what are the most common issues that you see that patients drop out, and then we'll go into the specifics of those.
Definitely. So it's a very important issue. As you mentioned, we see it in our program, but believe it or not, actually our program has one of the least dropout rates, when you look at the statistics around the country. So despite all our efforts, we still see dropout rates as well. And of course, we will come to the reasons that we see. But a bigger question that I would like us to look into a little bit, Kemal, is that why is it, when you have a treatment that clearly takes care of so many medical problems the person is suffering with, leads to extension of life, adding years to the person's life, adding quality to the person's life, why are people so reticent about it, right? We don't see that with other surgeries. When people come to my office and they've been recommended gallbladder surgery, they've been recommended surgery to remove a part of their intestine, or when the patients come to see our colleague, Dr. Vade, who does colorectal cancer, and patients have been recommended surgery to remove a cancer, there is no question. Patients follow up the recommendation to the teeth, right? In fact, their biggest question is, how soon can the surgery be done, right? And yet there is this. And in part, it has to do with the fact that we're still struggling to overcome this huge bias against obesity and its treatment, right? We are having still challenges in making people understand that we're not dealing with a lifestyle issue, we're dealing with a health problem. And with bariatric surgery, we have the most effective treatment when it comes to severe obesity. It has been proven, and bariatric surgery is one of the most scrutinized treatments for a number of reasons, and it's really safe, and the quality of outcomes has been proven to be very, very high. So that lingers over patients' heads very often. And of course, we see the specificities. For instance, one of the common reasons we see people dropping out is fear of complications, because obviously surgery elicits a certain degree of anxiety, and that, stops people from proceeding very often. And that's obviously different from other surgeries, as I mentioned, because, people are anxious when we recommend gallbladder surgery. People are anxious when we recommend cancer surgery, and yet they overcome that anxiety because the sense of importance of that surgery, overcomes that reticence, but that doesn't happen with bariatric surgery. So fear of complication is one of them. And the other one that I see very frequently is lack of support in their own, family or friends. Again, that lack of support comes because there is bias against obesity.
So that's kind of like the social stigma, maybe?
Totally.
Right. So let's elaborate that a little bit. It's like why maybe those family members don't really understand this, and how can the patient overcome that problem?
Absolutely. So the key here is that, if you have, loved ones, family members, friends who may not necessarily struggle with weight to the extent that the patient does, right? They will have a certain bias as to why that person is struggling, right? And very often, related to the stigma of obesity, they will probably think that that person doesn't have enough willpower to do it by themselves, right? That's how they look at it. And they look at surgery as a cop-out, as an easy way out, right? And so surgery is being looked at as a solution that is really an option that shouldn't be there because the person should be able to do it by themselves. When your loved one is really starting from that premise, then there's not going to be encouragement, definitely. And then there may be resistance even when you're asked them to support you. And this is a type of surgery that requires good support at home, not only obviously to recover from the surgery, but more importantly, to be successful in the long term.
Sure.
You do require that setup. And a lot of our patients have to overcome these barriers, and perhaps they've been thinking about surgery for a long time and they've never had really the courage to pick up the phone and make the consultation because they were worried about this judgment, perhaps, or lack of support that they would have from their loved ones.
So in terms of financial barriers, and maybe we can include the insurance coverage. I'm going to actually just rephrase this insurance coverage, and then this is one of the things that I did in the earlier session today. So it's not an insurance necessarily, it's the insurance and employer coverage. So if whether or not the employer is providing that coverage, how do you see those financial and insurance issues, coverage issues for bariatric surgery, and what's the long-term fix for that?
So there are two issues here, Kemal. There is the real problem of insurance companies denying care when it comes to obesity care. And there is the perception of patients assuming that there will not be coverage because obesity care is not seen as a bona fide medical treatment, right? So if you are struggling with obesity and your perception is that this surgery is really not a medical necessity, then you may assume that your insurance company is not cover it. So that by itself, that perception by itself will stop you from taking the initiative to seek treatment because you're going to think, I cannot afford it. It's surgery, it's doctor's visits, and it's going to be expensive. I cannot do it. So that's the initial barrier, the perception, right? But that perception is created by a reality. And that reality is there is a bias against obesity care. And that also is reinforced by the fact that there are, even in this day and age, insurance companies who deny or put lots of obstacles in front of patients who are trying to get bariatric surgery. Let me give you examples of that. You may have an insurance company that outright excludes bariatric surgery from their plans, right? Or you could have an insurance company that encourages employers through different incentives to include bariatric surgery as part of the treatments that are offered, right? Or you could have an insurance company saying that patients have to fulfill X, Y, Z in order to qualify for bariatric surgery. So adding more and more barriers, So all these issues, rather than encouraging patients to seek care, they are putting obstacles. So how do we overcome that? Well, we have to advocate for our patients. And sessions like Bariatric Friday is really doing that to its own capacity, right? But it needs to be more. The community needs to be aware that obesity is really becoming the leading cause of mortality in our society, right? Because of obesity, this generation may be the first generation to have a shorter lifespan compared to its previous generation. right? Because of obesity, you have people in later life really suffering with cardiovascular disease, diabetes, kidney failure, and many other illnesses. And instead of spending the later years of their life with quality, they're spending them just going from hospital visit to hospital visit, right? This is what we have to educate people about. And also, and then the other important part is that it's not easy to lose weight without effective help. Mm-hmm. It's not easy. No one can do it easily. Not even people who have all the resources are able to do that, particularly when obesity reaches a certain point, right? It is extremely difficult, if not impossible.
So today, as you guys know, we have two different case conferences. I started with the 8 a.m. with ACO and the 10 a.m. with Bariatric. In the ACO case conference, there were actually back-to-back, there were two patients where they lost 20 BMI points. Now, our nurse actually marked the patient from the ACO side that morbid obesity still needed to be followed up, because after losing 20 BMI points, patient was still at 37 BMI. Yeah. So started with 57. 57 BMI is a lot of BMI. Yeah. So, and then another patient, I think that it was about 18, if I'm not mistaken. Mm-hmm. And seeing these results are important for a group of people who are struggling with morbid obesity, and seeing these, issues and then trying to actually remove these barriers during the process is really important. But one of the other problems that we see, not necessarily a problem, but maybe this is for us to be more precautious about how we are prepping the patient for the surgery. So there are some requirements that we want patients to go through, and for some patients, this can be kind of overwhelming, not understanding why they have to go through this. If we can kind of address this issue of why we need these steps to be completed before the surgery, and the important part for the longevity of the bariatric surgery.
Absolutely. So clearly, we have learned, Kemal, that good preparation from a medical point of view, from a nutritional point of view, from a psychological point of view, leads to great outcomes. Okay? And we have learned that the best centers invest time and resources on this. And they are rewarded with excellent outcomes as a result of that, right? Which means that when patients come to us, they come to us either with many comorbidities, illnesses. They come to us with different levels of understanding on fundamental things of nutrition. And they come to us also with different degrees of struggles with mental health, right? All things that need to be addressed properly if we want them to go through the surgery safely, and importantly, if we want them to be successful in the long term, right? Sure. So that preparation, however, Kemal, does not have to translate into very, very unattainable, long-winded requirements that very often we see with from insurance companies. So our intention is not to do that. In fact, far from it. So we do want our patients, for instance, to have screening for possible heart problems, and they may not have symptoms, but that screening is important because we want them to get through the anesthesia safely. We want our patients to have solid foundational nutritional education and evaluation, which means encounters with nutritionists. We want patients to be screened by a mental health counselor to make sure that if there are mental health problems, they are addressed properly and expectations are set in the right manner. We want to make sure that we know that patients don't have an ulcer in the stomach, or they don't have irritation in their food pipe. So we have to do something called endoscopy so we can have a look inside, right? So all that preparation is valuable and important, but it does not have to be done over 6 months. It can be done. In fact, our program is so well streamlined right now, particularly with the fact that your team does the case conference on a daily basis, you are able to support patients, and patients can navigate the system seamlessly. And support is at hand every time they have questions.
Absolutely.
With that investment, we're actually able to make it a lot easier. So I haven't actually found, especially in our practice, in recent times, any patient who has had difficulties navigating the system.
I mean, you and I, we have seen so many different programs around the country, and no other program has designated nurses assigned to a patient and have the daily case conferences. Right now, it feels like sometimes I feel like when we do these things in certain disciplines, I feel like this is for everyone. But then, while we were doing this with the hospital system, we were limited with once a month, only for brand new patients, and it would never be discussed again if the patient once is presented. So from that to daily case conference and seeing the process, having the designated people, so we made this a lot easier for the patients, and that's one of the things that you mentioned earlier. The reason we have a very low dropout rate, we are about 50% better than national average. I believe 76% of the patients who start the program goes through the program. And that's, I believe, it's 55% nationwide.
Yep.
So, and we take this, and our understanding is very, different. And that's why we are probably better than other programs. And then also, that's why we are able to do this with this process. Patients are able to go home on the same day.
Yes.
So that's, a lot of people still have difficulty understanding that. And yet, that's what we have been doing, and that's what makes our program more successful. Now, question, in the office visits, patients, do they come with someone usually, or do they come alone? What's the norm that you see?
It's a mixture. It's a mixture, Kemal.
Is it most like maybe 50% comes with someone? Or?
Yeah, I think they do. They do. I would say probably the majority, though, probably slightly higher majority would come with somebody. To the office.
Are they usually friends or family members?
Usually it's family members, but we do see.
Because their understanding is important, right?
Absolutely, absolutely. So, it's interesting because I actually encourage particularly spouses, or parents, if they are young, the patient is a young adult. I don't actually encourage them not only to come to the visits, that we have with them, together, but also even go to the nutritional counseling sessions, with their loved one, so that their loved one can also understand. Apart from the fact that those teachings are actually very good for anybody, right? But actually, if they understand, their loved ones understand that, then they will be more supportive. And that support is very, very critical, right? But we do see some pushback. Sometimes we do see some loved ones who also are very reticent to support, and they will voice that even in the consultation. But very often, actually, I see that, things change by the end of the consultation when everything is explained, When we start talking about obesity and its implications in health terms, then people start understanding. When they start thinking, well, the reason, they have type 2 diabetes is when they started gaining weight. The reason they are taking blood pressure medication is when they started gaining weight. The reason they have sleep apnea is when they started gaining weight. All those things then become apparent. And then the issue of trying to control these symptoms one by one, whilst the obesity runs wild, it doesn't make any sense at all. Sure. It's like a patient I saw recently, relatively young patient in their 30s, very reluctant to go ahead with the surgery. But, the BMI is around 57, 58. The weight is around, high 300s for the patients who are in their early 30s now. So what is the prospect? If this is not controlled now, what is the prospect? And that's what we discussed, is that 10 years from now, that patient's weight, if unchecked, it's likely to be over 400. And once we reach the high 400, then even daily living becomes handicapped, right? So now you cannot go to any place without planning which city you're going to sit into.
Well,
right?
I mean, like,
So,
Dr. Ergau, one of the things, our body is like so interesting, and in a way, sometimes so smart, but sometimes so fragile.
mhm.
Like, if we have some small problem, like some infection uh, uh, on your foot, okay,
Yeah.
small infection, so life stops, right?
Yes.
So if you have a little, if your eyelash, one of them goes in, that little thing just stops everything for you.
Yes.
You stop the train, right? So
Yeah.
it's so crazy. Like if you have an ingrowing nail,
Yeah. Toenail. Yeah.
so
Yeah.
entire energy is there. So then this is how kind of the responses that we get from the body. But when it's morbid obesity, the message is not that clear.
Yeah. Yeah.
So at least this is, this is what the way that I see it is. The message is usually, yeah, you are tired, but you don't know why you are tired, or you are not able to sleep, but you think that you have sleep apnea. Well, yes, you do because you have morbid obesity, but yes, you are not. I mean, you are tired not because you have hypertension. It's because you have morbid obesity. You have hypertension, your diabetes. All these, I think, when for a small issue where it makes a huge, deal, for this big issue, I think our body is not really communicating with us. I mean, would you agree with that? Or?
Well, that actually goes to the heart of understanding the pathophysiology of obesity, right? We know that obesity creates a disease state, but when you look as to why our body allows that, there are ways to understand that. In that, the body that we have right now, the physiology that we have, does not really know how to get us to lose weight. It knows very well how to get us to gain weight. And if you think about it, as humans, for the 90% of our existence as humans through generations, it was very important for us to learn to gain weight rather than to lose weight because food was not available. So getting storage of energy was critical. And that's what our body did. Well, the key is now the transition we've made as a society of humans now with ready availability of food. Lack of food is not a problem for, at least in many places of the world now, which means that abundance of food now has not translated into change of our physiology, and it cannot, because these changes in physiology require much long time frames, essentially. But how does then the excess accumulation of fat really create so many illnesses? It's something that we are trying to grapple with. But I do want to take up one very important issue, and that is how people are unaware of the accumulation of weight over time. Right? There was actually a very interesting story that was told by a bariatric surgeon who he himself underwent bariatric surgery. And the story he told was that he never thought of himself as being very heavy. But you know what, Kemal? He never weighed himself. He never weighed himself until one day he found himself in an airport area for cargo. And they had these huge scales there for things. And he just said, you know what? I'm going to weigh myself, because he always thought that the small scales would not give him the right answer. So he was really ignoring the problem, right? But he said that he went on the scale and he almost fell because the scale read 460 pounds.
Oh my.
460 pounds. And he did not think of himself as heavy at that time, right? So there is a certain level of, not really following up, because we're looking at ourselves in the mirror every day and we don't see the changes, right? Until we see it, right? And that sneaking type of the weight is what gets people really, to suddenly wake up one day and say, hey, I'm having a hard time, putting my shoes on, or I'm having a hard time reaching my back with my hands, right? And then suddenly all other things come together as well. The fact that they're taking lots of medication for different illnesses, right? But at that time, we have to be ready to help them. The last thing they want is for us to put barriers, right? Whether you're an insurance company or whether you're the loved one, that is a time when we need to say, yes, this is a serious health problem and it requires a serious solution. And bariatric surgery is that. It's a serious solution, but for a very, very serious problem.
So that's being used to certain things, right? Like that's what I was saying about the case conference. Like when we do it daily, I feel like everyone is doing it.
Yeah.
So then we get used to it. So then I think when you see yourself every day and not realizing you may be actually gaining weight, unless you are weighing yourself. So I can see how that can happen. But again, the issue of our body not telling us strongly, hey, this is what's happening and it's going to bother me long term. Like the ingrowing hair, like, you know how much pain?
Yeah, of course.
Like your life stops until you take care of it.
Yeah.
But you have morbid obesity and it's passive. It's not doing anything.
Yeah.
I think the body needs to get a little bit smarter. Are there any foods that can make us smarter? No. Okay. So now, one of the things that I want also our audience to know that we have a lot of patients who drop, but then they come back.
Yes.
If I have to guess, at least 25% of the people who drop, like in the last 18 months, they come back. The problem is every time they come back, they gain a little bit more weight. Yeah. I haven't seen one single patient who lost weight after the last consult. Yeah. And now, like they were 43 and then now they're 40 BMI. I haven't seen that.
You don't.
So now knowing that there's a fear for surgery, financial challenges, going through the surgical clearance process and not having enough support, expectations that we set for ourselves and some of the other perhaps conditions that we may have, these are part of what we have to deal with and it's part of our life. So the important thing is what also our life is our own body and then we have to take care of that in the best way that we should for the longevity of our health, our well-being, and also having quality time with our loved ones. So this is not a cosmetic surgery. This is a very important surgery that actually fixes the chronic problem that we have. And I'm hoping that those who are looking for solutions, they can find us on YouTube or come to our offices and then see how much availability we have and then how much support we have so we can help and make their journey much better and successful. So, Dr. Irgau, thank you so much for joining me today.
Thank you.
We'll have another live session next week, and then we'll have a couple of weeks break after that. But we'll still have videos playing at the same time. So we'll be back with another topic Friday the 31st. We'll see you soon. Well, thank you again.